Niacin might not make headlines like vitamin D or omega-3s, but it's quietly responsible for one of the most striking public health victories of the past century. While once associated with devastating deficiency diseases like pellagra, niacin has become a textbook example of how simple nutrition policies, like food fortification, can transform health outcomes on a massive scale. Fortifying staple foods like flour with niacin has saved millions of lives, especially in low-income and vulnerable populations, and remains one of the quiet triumphs of modern nutrition. In the early 20th century, pellagra was a major public health crisis across parts of the United States, Europe, and much of the developing world. Entire communities, particularly in the rural American South, suffered from this mysterious and deadly disease that came with a grim triad of symptoms: dermatitis, diarrhea, and dementia. In many cases, untreated pellagra ended in death. At the time, it was misunderstood. Many believed it to be infectious or related to corn. It wasn't until the 1930s that researchers, particularly Dr. Joseph Goldberger, identified niacin deficiency as the root cause. Once that link was established, it became clear that simply improving dietary intake of vitamin B3 could prevent and even reverse the disease. This realization gave rise to food fortification policies, particularly the enrichment of white flour with niacin, iron, thiamine, and riboflavin. It wasn't just a feel-good gesture, it was a targeted, science-backed intervention designed to fix a very specific public health problem. By the 1940s, mandatory fortification programs in the US and elsewhere began to roll out, and the impact was dramatic. Pellagra, once a widespread and deadly disease, became virtually non-existent in industrialized countries within a generation. What once took the lives of thousands every year was stopped not by expensive treatments or fancy drugs, but by simply adding a few missing nutrients to a food nearly everyone consumed daily. And it wasn't just the US. Countries around the world adopted similar strategies. In Latin America, Southeast Asia, and Sub-Saharan Africa, flour fortification programs became essential tools in the fight against malnutrition. In populations where poverty limited access to diverse diets, fortified foods provided a safety net. The addition of niacin to flour and cereal products ensured that even the most basic diets contained enough vitamin B3 to prevent deficiency. For low-income children, pregnant women, and people in food-insecure areas, this small change made a disproportionately large difference. Niacin's success in this context is particularly impressive because it highlights how nutrition can work on a systems level. Unlike supplementation programs, which rely on distribution, compliance, and behavior change, fortification is passive. It doesn't require people to do anything different. You just eat your bread, your tortillas, your noodles, and you get your niacin. It's a subtle, elegant solution to a complex public health challenge. Interestingly, niacin fortification also brought additional, unexpected benefits beyond pellagra prevention. As more became known about the vitamin's role in energy production, brain function, and cardiovascular health, it became clear that adequate B3 intake wasn't just about avoiding deficiency, it was about optimizing health. Fortification quietly helped elevate entire populations above the bare minimum, ensuring better developmental outcomes for children, more robust immune function, and improved resilience under stress. Of course, no system is perfect. In some high-income countries, ultra-processed foods rely heavily on enriched flour, leading to a situation where people are technically meeting their niacin needs but still eating poorly overall. And in certain communities, excessive supplementation or the overuse of fortified energy drinks has raised concerns about niacin overload. But in the broader context, these are relatively minor wrinkles in what is otherwise a remarkable success story. The legacy of niacin fortification reminds us that not all health interventions need to be revolutionary to be powerful. Sometimes it's the quiet, incremental solutions, the ones that slip into our everyday routines without fanfare, that have the most profound impact. It also underscores the importance of policy in shaping health outcomes. Left to individual choice, nutritional gaps often persist, especially in communities struggling with poverty, education barriers, or limited food access. But with smart public health infrastructure, those gaps can be closed almost invisibly. Niacin may be a modest nutrient, but it's played a heroic role in protecting global health. It helped turn the tide on pellagra, safeguarded vulnerable populations from deficiency, and continues to offer quiet insurance against the ravages of malnutrition. In a world that often looks to flashy breakthroughs, it's worth remembering the power of a well-fortified slice of bread.